Are you unknowingly damaging your most sensitive organ every single day? Hi, gentlemen. I'm Dr. Grace Miller, a urologist with over 2 decades helping seniors protect their health. And today, I'm going to show you 5 things that are quietly destroying your penis health, and most men have no idea it's happening. These aren't rare conditions or complicated diseases. These are everyday habits and mistakes that are silently causing damage right now. But the good news? Every single one of them can be fixed, starting today. Let's be honest about something most men won't discuss, even with their own doctors. As you get older, things down there start to change. Maybe it's not working the way it used to. Maybe sensation has decreased. Maybe you're worried about what you're seeing or feeling, but you're too embarrassed to ask anyone about it. Here's what I want you to understand. Your penis health is directly connected to your overall health. When something goes wrong down there, it's often your body's way of telling you something bigger is happening. According to research from Johns Hopkins University, problems with erectile function are often the first warning sign of heart disease, diabetes, or circulation issues. Your penis is like a check engine light for your body. But here's the truth nobody talks about. Most of the damage being done to your penis health after 60 is completely preventable. Simple mistakes in daily habits, things you might be doing right now, are causing problems that don't need to happen. Today, I'm going to walk you through the 5 biggest destroyers of penis health in men over 60. And more importantly, I'm going to show you exactly how to fix each one, with simple, practical steps you can start using immediately. Let's get into it. Before we talk about what's destroying your health, you need to understand how everything works. Your penis relies on 3 critical things to function properly: blood flow, nerve sensitivity, and tissue health. When blood vessels are healthy and open, blood flows freely into the spongy tissue inside your penis. That's what creates firmness and function. When nerves are healthy, you feel normal sensation and pleasure. And when the tissue itself is healthy, everything works the way it should. But as men age, especially after 60, several things start working against you. Hormonal changes reduce testosterone. Blood vessels become stiffer and narrower. Circulation slows down. And tissue that isn't used regularly can actually shrink and lose elasticity. The medical term for this is penile atrophy, and it's more common than most men realize. But here's what gives me hope as a urologist. Almost every single factor that causes these problems can be controlled through simple lifestyle changes. You have more power over this than you think. So let's talk about the 5 biggest threats and what you can do about each one. Destroyer number 1, poor circulation. The number 1 destroyer of penis health after 60 is poor blood circulation. Your penis is essentially a blood flow organ. Without strong, healthy circulation, nothing works properly. And unfortunately, the same things that damage your heart and blood vessels damage the delicate blood vessels in your penis first. According to research from Cleveland Clinic, conditions like diabetes, high blood pressure, and high cholesterol directly damage the lining of your blood vessels. This makes it harder for blood to flow freely, especially to smaller vessels like the ones in your penis. Smoking is one of the worst offenders. It constricts blood vessels, reduces oxygen in your blood, and speeds up the formation of plaque inside your arteries. Studies show that men who smoke are twice as likely to experience erectile problems compared to non-smokers. But it's not just smoking. A sedentary lifestyle, sitting for hours every day, also slows circulation throughout your entire body, including your pelvic region. How to fix it? Start moving. You don't need to run marathons. Even 30 minutes of walking daily can dramatically improve circulation. Studies show that regular aerobic exercise improves blood flow, strengthens your heart, and can restore function that's been lost. Eat foods that support healthy blood vessels. Leafy greens, berries, fatty fish like salmon, nuts, and dark chocolate all contain compounds that improve circulation and protect blood vessel health. And if you smoke, quit. It's the single most important thing you can do for your penis health and your overall health. Talk to your doctor about cessation programs that actually work. Hydration matters too. Dehydration reduces blood volume, making it harder to achieve proper blood flow. Aim for at least 6 to 8 glasses of water daily. Destroyer number 2. Improper hygiene. The second destroyer is something most men don't think about. Improper hygiene practices. Now, I know what you're thinking. Dr. Miller, I shower every day. But there's a difference between showering and actually cleaning properly. Poor hygiene can lead to a buildup of something called smegma. This is a natural substance made of dead skin cells, oils, and moisture that accumulates under the foreskin, or around the head of the penis if you're circumcised. When smegma builds up, it creates the perfect environment for bacteria and yeast to grow. This can cause inflammation, irritation, unpleasant odor, and even infections, according to health guidelines from Mayo Clinic. Proper daily cleaning is essential for preventing these problems. But here's the key. You need to do it correctly. How to fix it? Wash your penis every single day with warm water. If you have a foreskin, gently pull it back and clean underneath. If you're circumcised, clean around the head thoroughly. Use gentle, fragrance-free soap if you want, but water alone is usually enough. Avoid harsh soaps, body washes with strong fragrances, or any products with alcohol. These can irritate the sensitive skin and cause more problems than they solve. After washing, dry the area completely. Moisture left behind can lead to fungal infections, especially in the folds of skin. And here's something many men don't know. You should also trim or groom your pubic hair regularly. Excessive hair can trap moisture and bacteria, creating hygiene problems. This takes less than 2 minutes a day, but it prevents infections, discomfort, and embarrassing situations. Destroyer number 3. Tight clothing and underwear. The third destroyer is something you're probably wearing right now. Tight clothing and the wrong underwear. Many men over 60 still wear the same style of underwear they've worn their entire lives. Tight briefs, restrictive pants, or synthetic fabrics that don't breathe. But these choices are quietly causing damage. Tight clothing restricts blood flow to your genital area. It also increases temperature, which is bad for both testosterone production and overall tissue health. Your testicles and penis need to stay slightly cooler than the rest of your body to function properly. Synthetic fabrics like polyester trap heat and moisture, creating the perfect environment for bacterial and fungal growth. This can lead to rashes, infections, and chronic irritation. Studies published in reproductive health journals show that men who wear tight, restrictive underwear have higher scrotal temperatures, which can affect hormone production and overall genital health. How to fix it? Switch to loose-fitting, breathable cotton underwear. Boxers or boxer briefs made from natural fabrics allow air circulation and keep the area cooler and drier. Avoid wearing tight jeans or pants for extended periods. If you sit for long hours, take breaks to stand and walk around, allowing circulation to return. At night, consider sleeping without underwear. This gives your genital area maximum airflow and allows your skin to breathe completely. Many urologists recommend this practice for optimal genital health. These simple changes can dramatically reduce discomfort, prevent infections, and improve overall function. Destroyer number 4. Certain medications. The fourth destroyer might surprise you. It's certain medications you're already taking. Many common medications prescribed to men over 60 have side effects that directly impact sexual function and penis health. And most doctors don't warn you about this when they write the prescription. Blood pressure medications, especially older types like beta blockers and diuretics, can reduce blood flow and make it difficult to achieve or maintain an erection. Antidepressants, particularly SSRIs, are notorious for causing sexual side effects. They can reduce desire, decrease sensation, and make it harder to function normally. According to research from Johns Hopkins, medications for acid reflux, allergies, and even some pain relievers can interfere with sexual function in men over 60. But here's the important part. You should never stop taking prescribed medications without talking to your doctor first. How to fix it? Have an honest conversation with your doctor about side effects you're experiencing. There are often alternative medications that don't have the same impact on sexual function. For blood pressure, newer medications like ACE inhibitors or calcium channel blockers tend to have fewer sexual side effects. For depression, Wellbutrin is known to have less impact on sexual function compared to other antidepressants. Ask your doctor about timing. Sometimes, taking medications at different times of day can reduce their impact on sexual activity. And keep a medication journal. Track what you're taking and any changes you notice. This information helps your doctor make better adjustments. Remember, your quality of life matters. Sexual health is part of overall health, and there are almost always solutions available. Destroyer number 5. Lack of use. The 5th destroyer is something most men don't realize is happening. Lack of use. There's real science behind the phrase, use it or lose it. When your penis isn't regularly experiencing blood flow, whether through sexual activity or morning erections, the tissue can actually begin to deteriorate. The smooth muscle tissue inside your penis needs regular oxygenated blood flow to stay healthy and elastic. Without it, the tissue can become fibrous and less flexible. This is called penile fibrosis, and it can lead to permanent changes in size and function. Studies show that men who maintain regular sexual activity, whether with a partner or alone, have better long-term function compared to men who are completely inactive. But here's what many men over 60 don't know. Even if you're not sexually active with a partner, maintaining regular blood flow through self-stimulation is actually a medical recommendation for preserving tissue health. Research, published in the Journal of Sexual Medicine, found that regular sexual activity helps maintain healthy testosterone levels, improves mood, reduces stress, and preserves erectile function as you age. How to fix it? Stay sexually active, whether with a partner or through self-care. Aim for regular activity, at least once or twice per week. This keeps blood flowing, maintains nerve sensitivity, and preserves tissue elasticity. If you experience morning erections, that's actually your body's natural way of keeping things healthy. These spontaneous erections bring fresh oxygenated blood to the tissue. If you've stopped having them, it might be a sign to see your doctor. Consider pelvic floor exercises, also called Kegel exercises. These aren't just for women. Strengthening your pelvic floor muscles improves blood flow, enhances sensation, and can improve control and function. To do them, tighten the muscles you use to stop urination midstream. Hold for 5 seconds, then release. Repeat 10 to 15 times, 3 times a day. Within a few weeks, most men notice significant improvements. Now, here's what makes this truly powerful. When you address all 5 of these destroyers together, the results multiply. Improving circulation through exercise and diet helps every aspect of function. Proper hygiene prevents infections that could cause inflammation and damage. Wearing the right clothing supports healthy temperature and blood flow. Managing medications removes barriers to normal function. And staying active preserves the tissue and nerves you need. Together, these 5 changes create a complete strategy for protecting and even improving your penis health after 60. But let me be clear about something. If you're experiencing persistent problems, pain, unusual discharge, lumps, bumps, or significant changes in color or texture, you need to see a urologist immediately. These 5 destroyers cause gradual, preventable damage. But some conditions require medical attention. Don't ignore warning signs hoping they'll go away. Early detection and treatment make all the difference. I've seen men avoid serious problems simply because they came in early instead of waiting. Your health is too important to ignore. And there's no shame in taking care of yourself. Let's quickly recap what we've covered today. 5 things destroying your penis health after 60, and how to fix each one. Number 1, poor circulation. Fix it with regular exercise. A healthy diet rich in circulation-boosting foods, proper hydration, and quitting smoking. Number 2, improper hygiene. Fix it with daily gentle cleaning using warm water, drying thoroughly, and keeping the area well groomed. Number 3, tight clothing and wrong underwear. Fix it by switching to loose, breathable cotton underwear. avoiding restrictive pants, and sleeping without underwear when possible. Number 4. Certain medications. Fix it by talking honestly with your doctor about side effects and exploring alternative medications that don't interfere with sexual function. Number 5. Lack of use. Fix it by staying sexually active, doing pelvic floor exercises, and maintaining regular blood flow through the tissue. Start with one change today. Pick the easiest one for you and build from there. Most men see noticeable improvements within 4 to 8 weeks. Better function, better sensation, and renewed confidence. Now here's what I want you to do right now. First, hit that like button if this information helped you. It tells me you want more honest, practical health advice, and it helps other men discover this life-changing content. Second, subscribe to this channel and turn on notifications. I'm releasing new videos on senior men's health every single week. Real topics your doctor might not discuss openly, but you absolutely need to know about. Third, drop a comment below right now. Which of these 5 destroyers surprised you the most? Or which one are you going to fix first? Let me know. Your experience might encourage another man watching this to finally take action. Fourth, share this video with a friend who needs it. Someone you know who's dealing with these issues but too embarrassed to talk about them. You could literally change their life by sending them this video. And finally, when you're ready for more essential health information, watch the video appearing on your screen right now. It's about the 5 fruits that shrink your prostate naturally. It connects directly to what we discussed today about circulation and overall health. Thank you for watching. I'm Dr. Grace Miller, and I'll see you in the next video. Take care of yourself, and remember, your health is always worth protecting.